Hi, everyone, and welcome to today's webinar. This webinar is brought to you by WHO TDR, the COVID-19 Clinical Research Coalition, and the Global Health Network, or TGHN. Today, our topic is COVID-19 focused platforms and registries for sharing participant-level data. These include clinical epidemiological data, OMICs data, and imaging data. I'm Peg Yong Chia. I'm the chair for this webinar. I'm from the Mahidol Oxford Tropical Medicine Research Unit, University of Oxford, based in Bangkok. I'm delighted to be joined today by Lauren Maxwell, Susana Asunta Sansoni, Frutsina Molnar Gabor, Abba Saxena, John Amwasi, Yo Yehudi, and Jeremy Gillen. In this webinar, we present a comprehensive living overview of COVID-19 related platforms and registries for sharing participant-level data. We review the interoperability of data sharing efforts and how these initiatives map to the best practice for ethical, equitable, and effective data sharing, and how we apply the FAIR principles in managing data resources. So, without further ado, I'd like to welcome the first speaker, Dr. Lauren Maxwell. Lauren is a senior researcher at the Heidelberg University's Institute for Global Health, TDR, and the WHO Department of Sexual and Reproductive Health and Research. She will be presenting the spreadsheet overview and findings. Lauren, the floor is yours.
Perfect. Again, thank you so much. So today we'll be talking about platforms and registries that have or continue to collect, harmonize, and share COVID-19 related participant level data. And this is work that has been ongoing since the summer of 2020. So as Young mentioned, this is a spreadsheet that we continue to update. We began with monthly systematic searches and consulted with colleagues to identify resources for harmonizing, storing, and sharing COVID-19 participant level data. And we also conducted natural language processing to identify non-English language resources. So we started our work with some key questions about how participant level data are being shared for COVID-19, including how are data being shared, what data are being shared, how fair are these resources, and then how do resources address legal and ethical concerns, benefit sharing, either with the groups that produce the data or folks that participated in these studies, and community engagement. So our work to document these resources that collect, harmonize, and share participant level data for COVID-19 is available on the Global Health Network, Zenodo, and then also on fairsharing.org. And these are the links. So we found 68 COVID-19 related platforms and registries. And we also reviewed a number of catalogs of platforms and data lakes. So where harmonization was not conducted between different data sets or other types of data sharing resources. Importantly, we found that data sharing efforts were often siloed by data type, comorbidity, co-infection, or special population. Many of the registries did not well cover the FAIR criteria. So that means that the participant or the participant level data or study level metadata may not be findable, accessible, interoperable, or reusable, which we know limits data utility. Many of these registries did not require patient consent. And then a few platforms or registries included benefit sharing with the groups that contributed data or engaged the communities that participated in the studies or from whom data were collected. So registries, which generally only collected clinical or epidemiological data, were often siloed by comorbidities and sometimes by treatments or by special populations. So we found 6 registries for cancer, 3 registries for blood conditions, 3 registries for that dealt with the cardiovascular system, 7 that dealt with skin conditions, 3 registries for rheumatic disease and for the digestive system, 2 registries for liver disease and for multiple sclerosis, and then 4 registries for pediatric populations and 2 registries for pregnant women. So both the platforms and many registries were generally divided by data type. So all but 2 of the registries only collected clinical or epidemiological data. And then there were a number of platforms that only collected human or pathogen omics data, so without that connection to the clinical data. very few of the platforms and no registries collected linked clinical and human omics data or clinical data that were linked to human pathogen omics data at the participant level, which we know is very important for understanding the emergence of variants of concern and the public health response to those variants of concern. Next slide, please. Data access was managed in different ways. So most platforms and one registry were open access. Many registries and some platforms had what's called a data access committee. And there were some platforms and registries where the data providers managed data access. Importantly, we found that 17 registries did not have plans to share participant level data. And we could not identify the data access mechanism for 8 registries and for 1 platform. Many registries had data dashboards, which is one way to return some benefit to researchers or to the communities that participate in the research or whose clinical data are used. Most platforms, but few registries, required citing the groups that contribute data, and no registries and only 4 platforms mentioned any form of community engagement. Most resources for collecting, harmonizing, and sharing participant level data are based in Europe and North America. Here you can see the distribution of platforms, which oftentimes deal with high dimensional data types. So it could be human or omics, human or pathogen omics data. And platforms also include both prospective and retrospective harmonization, while registries were generally limited to clinical data. So those are marked in orange on this graph. While platforms require larger investments and generally predated the epidemic, registries were all initiated during the epidemic. So when we think about how fair these data are, we consider the following 4 criteria to make that evaluation very simple. So we thought about findable as having assigned DOI. We thought about accessible as directions for how to access data that were available on the resources website. We thought about interoperable as applying a community developed standard for either the participant level data or the metadata. And then we thought about reusable as having a data usage license or an agreement in place for using that data. Many registries and platforms were assigned a DOI as part of this project. So we helped make some of these more fair, more machine readable. And then most registries, but very few platforms, met all of the fair criteria as we have laid them out here. And some platforms and registries met none of the fair criteria. And so here we see that registries, which often collect only data on specific comorbidities and are largely limited to clinical and epidemiological data, are not very fair. And that platforms, which may be limited to certain data types, but are not limited generally to comorbidities, and many of which predated the pandemic, are more fair. So in the end, we are left with a lot of challenges here. We describe some of these challenges. There are many more that we will talk about in the paper where we describe this research in more depth, but interoperability and accessibility of electronic health records is a major concern. The interoperability between electronic health records and research data is also a concern for trying to leverage electronic health records along with research data. We saw that resources were siloed by data type, comorbidity, body system. There's concerns about the lack of interoperability between these data sharing resources, so between the platforms and registries that we've described here. We have a lack of interoperability of governance structures and could certainly use some additional recommendations on how to structure what well-structured governance looks like. Many of these resources are not very fair. And then we don't perhaps see the types of benefit sharing or community engagement that we would ideally see to think about the ethical reuse of this data. And I think importantly here, we have clear competition for data. So competition between data sharing resources where we should really move towards cooperation and collaboration, interoperability of these platforms. So some of the other panelists will speak more to the recommendations that should come out of this work, and we have a few of them listed here. So I'd like to thank the team that worked with us on this, my colleagues Priya and Alyssa, and the funding that we received from TDR to do this work. Thank you.
Thank you, Lauren. So thank you. That's a huge amount of work there. So thank you very much. So we will move to the next speaker. The next speaker is Professor Susana Asunta Sansoni. She is the Associate Director of the Oxford E-Research Centre and Associate Professor at University of Oxford. She's the author of the FAIR Principles. Her Oxford group researches and develops methods and tools to improve data reuse, work for data transparency, and the evolution of scholarly publishing. She will talk about data policies and data sharing to support COVID-19 research, the role of fair sharing. Over to you, Susana.
Thank you very much, Pei-Yong, for introducing me. Right, okay, so you heard about, I mentioned the FAIR principles several times, and just to make sure that everybody knows what they are a set of really principle guidelines. They need to make sure the data is fundable, accessible, interoperable, reusable. But FAIRs are aspirational, really means that repository need to make sure that they implement persistent identifiers, common metadata standard, common terminology, richer metadata provenance, richer metadata descriptor for the data, as well as they define the term of access and use of the data. And this is really important. Making data fair, it's essential in science, but is even more important in emergency like the COVID-19 that we are living nowadays. And this example from the OECD, it really stressed the importance of having open data to combating the pandemic. And I highlighted specifically the text that really stressed the importance of having a network of interlinking repository with compatible standards to enable fair data. You already heard from Lauren the importance, of having data standardized, because a lot is not, and we know that. So what we are trying to do with the Fair Sharing initiative is to try to map this landscape of repository, platform, data resources, and understand if and how they use these standards, this terminology, this common identifier, common metadata descriptor, because only by doing that, we will have data that's more shareable, that's more comparable. We also need to understand if and how repositories are connecting among themselves. Do they share data? Do they import data from each other? And also it is important to understand how policymakers are recommending or sending their authors or the overseas towards those repositories to make sure that the data is available in these repositories that hopefully implement fair data. So with Fair Sharing, we are mapping this landscape. We are describing all these resources. And as you can see, there is over 300,000 resources for sharing. Most of them are repository, then they're standard and policy across the disciplines, but many of them are in the life and biomedical sciences. So what we want to do by providing this resource, we want to help the producer of this resource to make them more discoverable so that researcher can find it, but also the consumer of this resource to actually use them and deposit the data in these resources. What I'm going to show in the next couple of slides is the work that we have done with Lauren, Priya, and their colleagues. So we've practically taken some of the data platform that they have collected very thoroughly, and we have described them further and add them in for sharing and try to make it more discoverable and try to understand if they are related among each other, those repositories, which repositories, which standards, and if policy recommend. I'm going to walk through a little bit of this visualization of these recommended resources that we put in the Fair Sharings, which is a subset of what Lauren, Priya, and colleagues have collected. In this graph, you actually can see 28 of these resources, and in the small snippet, you will see that some of them are related because they import data from each other. We start enlarging the network, and we start looking at other repositories which are connected to these resources which are within the collection. We start seeing that there are more repositories outside. In this case, I'm highlighting one of the resource ENA, which is part of the collection, which is also connected to a number of other resources, which means ENA imports or connect to these other data resources. If we keep expanding the network, but now we look at what standard the repository, the data resources in the collection use, that we can see that some of them use many standards. I'm going to highlight, for example, that here EGA repository has a number of standards, but I'm also highlighting that, for example, the case report form is a standard used by many resources. If we enlarge the network, but we look at now what policy are recommending these data sources in the collection, you will see that there is a number of repositories which is very much adopted and known to the policymaker, that it's recommending more than other. And here in the snippet, I'm highlighting, for example, the repositories which are recommended by the Springer Nature, in this case, which are a publisher. My next slide, which is my last slide, really wants to bring an emphasis on the importance of making clearer and strong data policy. And this is something that both funders and publishers should do to make sure that author and data producer are directed towards the right repository and deposit the data so that the data becomes fair and findable. And here I want to highlight one of another initiative that Fair Sharing is involved, and that's called the COVID-19 Rapid Review. It's an initiative that brings together several publishers, open access publishers, with other scholar organizations, including the Rory Institute, for example. And the COVID Rapid Review initiative, it's really broadly on ensuring that both preprint and articles are quickly triaged and reviewed. But we also had, as part of initiative, a working group focusing on data, where we really worked on strengthening the data availability statement that these journals had, to make sure that the data underpinning the article is not only available, but is available in public repository that implement standard, because that's the only way to ensure that data is fair. And my last slide, it's only to acknowledge the Fair Sharing group, and thank you very much to Fonpen and Lauren and her colleagues. Thank you.
Thank you very much, Susana. That was a whirlwind tour of your very, very important and very large project. So without further ado, let's move on to the next speaker, Dr. Fruzina Molnar-Gabor. Fruzina is a legal scientist and her research group leader at the BioQuant Center and the Academy of Sciences and Humanities. She's in Heidelberg, Germany. Her research focuses on the regulation of data sharing in biomedicine. She's on a number of international expert committees, including EU's 1 Million Genomes Initiative and the Human Cell Atlas, and is co-editor of the Gdpr Forum and the Global Alliance for Genomics and Health. She will be talking about GDPR-related barriers to sharing sensitive data types and the way forward. Dr. Fruzina, please.
Yes, thank you very much for the kind introduction, and I'm very happy to be here. And in fact, I will be introducing some of the challenges that are related to data protection law. And when we think about these challenges, sometimes the first that comes into our minds is the general data protection regulation of the EU, which has often lately been brought as a subject matter of concern when it comes to international data sharing, also related to COVID-19 research and repositories and platforms. This is basically the very rough structure of the points I am going to shortly introduce, and that I hope to reflect very shortly with needs in legal research that need to be done to respond to these. And I would like to emphasize that although these examples around challenges and responding needs actually are somewhat related to the GDPR, I think they are somehow generalizable for most data protection laws. When we look into the application of data protection laws, and such as the GDPR, also the GDPR and many others are having a very broad scope of application. So any processing of personal data in the context of actors who are in the EU will fall within the scope of application. And the GDPR also defines a very broad scope of application when it comes to exporting data outside of the EU, so it has an extraterritorial effect. Now, of course, other data protection laws also are going to have such definitions, also similar to defining applicable laws, and they might contradict. So we need some kind of harmonization in the communication of all these applicable laws. There are, of course, specific questions related to platforms and registries, because if you are only providing access to data that is sitting in these platforms and you're not moving data physically around, you might not be introducing any international data transfer, whereas then might different rules apply. It all boils also down to the scope of application in a material sense. So data protection laws and the GDPR relate to personal data. Now, maybe personal data is not identifying a concrete person or is not identifiable, but if you link different data or you subtract metadata out of it, combined with other data, this also might become somehow personally identifiable. And it is very important to differentiate between technical and legal terms of anonymization, because the legal term does not mean a factual anonymity, but it means that throughout reasonable means, you're not able to identify the data subject. So there is this reasonability threshold, which is quite difficult to define. We are having a changing role of data subjects in the context of data protection rules. We have different kind of investigation methods, such as genomics, which changes the relation of results to the data subjects in the time. We have many new actors for international data sharing and research who don't have any direct connection to the data subjects. And of course, the healthcare relevance on an individual and stratified level based on research will be changing. There is often the way to use retrospective data where you might be missing a consent, but where you might find another justification. So the data subject's role might not be the justification for consent anymore, but they still should be allowed to assess what's happening with their data and evaluate this, and of course control. So their role is a bit changing, which needs to be reflected. We are also experiencing privileges for specific data processing purposes, and scientific research is, of course, one. Now, it's important to ask how we define scientific research, and it's actually very broad, also based on the GDPR. So any method-driven way of deriving new knowledge should count here, which is very good. And so the privileges basically apply to all kind of scientific research, also commercial, I would say in brackets. However, one intention of setting up registries and platforms is to organize data and to make it available first for this scientific research. So it's all about, in first instance, bringing order into the data that is there to be able to provide it for research. And so when you are in a role with your institution in being involved in preparing this data and sharing it for research, you might find yourself very easily in very heavy responsibilities as related to influencing what are the purposes and the essential means of dealing with this data. If you are defining essential means where it is questionable whether this kind of preparation of data to be able to do research with it counts as essential means, this would push you in a more responsible role from the data protection perspective, which I think is worth discussing whether this fits. And of course, we are having different data protection laws and rules, but we need to apply them. So there is much decided throughout the application. Laws are just general and they need to be applied to specific individual cases. And while doing so, it is often so that different legal positions and interests need to be balanced. Neither privacy nor scientific research is to be guaranteed without limitations. So we need to bring those two interests, and there are of course many other interests playing a role, into a balance. And what comes out as a result in bringing them into balance are actually data security measures. They are technical measures that should, on the one hand, provide for privacy and protection for data subjects also, but on the other hand, should enable scientific research. So actually what data protection also does, it's very important to be aware of this, is transforming legal decisions into technological decisions. Now, of course, there is no stratified, standardized way of balancing rights and interests. It is single case application in most cases, But what comes out then, depending on your balancing, might also influence the technological level and technological interoperability. It is also important to consider public interest. For instance, the GDPR defines scientific research in the public interest as privileged, differentiating this way between different kind of scientific research purposes. So this will allow you, if your scientific research, according to the GDPR, is in the public interest, to use those privileges. Of course, it is very difficult to define public interest. It is also a notion that should be assessed from the cultural, from the societal perspective. But of course, in the sense of infectious diseases, it is, I think, quite good to argue that related research is in the public interest, for instance. And this, of course, then once this guiding principle of public interest can be used, will affect how you apply those rules that define the scientific research and the data processing rules related to that. So I've listed just these 7 very minor and rough challenges that emerge when we are applying specifically the GDPR, but I think also related to many other countries' data protection laws. And I would like to give a few ideas where I think further research could be done, also on a governance level, where we could probably define a better way forward. Even though this balancing of different legal positions, rights and interests is related to individual cases, probably different scientific sector-specific contexts might be defined as having particular characteristics when it comes to these decision-making. So we might think about this of a certain kind of sectoral rules for this specific scientific research context in order to somehow standardize weighing and best interests. It is also a crucial idea to work towards platforms and registries as safe data spaces, so not moving data around, but providing access and defining the conditions thereof, or even analysis tools. I think we need more thoughts around technical and legal interoperability. I said they are very strongly connected, and I think that we need to further connect both concepts. We need to better define and better be aware of the public interest that is related to every kind of scientific research, but to particular areas. This might be more emerging and more actual and accurate. And I think that the connection between research and healthcare as related to public and individual level benefits also needs to be further sorted out. I hope to discuss these issues with you in a second, and thank you very much.
Thank you very much, Dr. Susana, for a very, very interesting talks. And so GDPR is very, very important, and many countries are developing their own version, as I might imagine. So thank you very much. We will move swiftly on. The next speaker is Dr. Abba Saxena. She is the former lead for the Global Health Ethics team at WHO. Dr. Abba Saxena is an independent bioethics advisor with a special interest in ethics of infectious diseases, outbreaks, health systems, and new technologies. She is currently the ethics advisor to several international research groups and a member of an independent resource group for global health justice. Prior to her retirement from WHO, Dr. Saxena led the ethics response of WHO during the Ebola outbreak and Zika outbreaks. She will present the ethical considerations in data sharing. Dr. Saxena, over to you.
Thank you. Thank you for this introduction. The discussion today is pertaining to sharing of platforms and registries-based data that ranges from clinical-epidemiological data to pathogen-related data and genetic sequence data. Naturally, the ethical concerns that arise are varied and depend not only on the data type, but also on the context in which the data is collected and by whom it is collected and how it is collected. And we also heard right now, currently, the technological challenges and the legal challenges that arise in data sharing. I'm going to focus on some of the ethical challenges and ethical obligations and responsibilities that accrue to different people. They don't accrue only to the data collectors and data users, who are the main spotlighted people and who have the main main people who are focused in the data sharing enterprise, but they also accrue to other stakeholders mentioned in this slide, who have these are all people who have interest in the data. And of course, their interests could be competing interests. And therefore, this means that to have an effect, there needs to be an effective ethics and governance structure which can balance the needs and the competing needs of these stakeholders. As such, ethics guidelines specifically for the development and use of data platforms and registries do not currently exist. But there has been a recent systematic review of available literature, and ethics guidelines identified the following ethical principles and values that are relevant. This slide outlines in bold the 4 principles that were identified in the systematic review that identify the 4 principles relevant for the ethical sharing of data. And mechanisms exist by which each of these principles can be operationalized. For example, societal benefits and the principle of societal benefits and value can be operationalized through implementing the FAIR principles and implementing peer review mechanisms and scientific oversight to ensure quality and scientific validity. However, a detailed discussion of each of these principles and values and how they can be operationalized will take a full webinar or more. So I intend to focus only on 3 areas that have been mentioned as being quote unquote problematic. That is of access and benefit sharing, of consent issues, and issues related to governance systems. With regard to access and benefit sharing, as mentioned earlier, that societal benefits and values can be realized by adhering to the FAIR principles, of which accessibility is one of the components. Accessibility, I believe, refers mainly to the fact that standardized procedures have been implemented such that data within a database is searchable, indexable, and accessible to all researchers with the appropriate know-how. And the keyword here is appropriate know-how. Global databases often establish collaborations with low and middle income countries. And in that context, access issues are also related to access of data by low and middle income countries of the global databases, but also vice versa. Access provided to global registries by the low and middle income country researchers. And such global databases do that to access more diverse data. However, relationships such as these are often skewed because either of power imbalances or resource imbalances. And from an ethics perspective, justice requires that benefits be put in place where such a skewed relationship exists. And such benefits usually currently take the form of recognition and attribution in publication of low and middle income country researchers who provide data to global registries. And also ownership rights are provided to them. But what I call real capacity building doesn't exist. Capacities are often raised for collecting data and sharing them, but not necessarily the capacity to use data. And here I refer back to the accessibility component of the FAIR principles. Accessibility of data means not only that it is available, but people who are wanting to use the data have the capacities to be able to understand what is in these databases, but also they have the necessary infrastructure, software, digital architecture available in their home institutions. And finally, they have the capacities to use the data. And by use, I mean they have the capacities to be able to develop diagnostics, therapeutics, or use these data to support other societal benefits. Current practices of capacity strengthening focus primarily on data collection, storage, and sharing. But if we have to develop more equitable data platforms, we need to invest in overall capacities, not just capacities to collect and share data, but also to be able to access it and use it. And funders, sponsors, and national governments may have a big part in developing these capacities. The second issue that I want to touch upon is informed consent, which for various reasons continues to be a stumbling block for sharing of data. And that could be because collaborations were developed post hoc, because data was already available and needs to be used for current use. And ethics committees are asking participants to be reconsented for reuse or sharing of data, which is often problematic. So because the provisions that were promised in the informed consent engender trust and trustworthiness, it is important that researchers think through the possible future use of the data for public health purposes, even though they may not know exactly what that use may be, and make appropriate modifications to the consent process. And ethics committees must make themselves familiar with all these considerations and be willing to be flexible and allow the use of a broad use of data in the consent processes. A broad and continuing stakeholder engagement prior to data collection can help develop appropriate consent mechanisms and engender trust in researchers, both by the communities and the ethics committee. So that's an important issue. And lastly, the governance system. It is recommended that large data platforms and registries that are the subject of today's discussions have an explicit governance system in place that will ensure integrity, solidarity, accountability, and ensure transparency. Such a governance system should be linked to and informed by stakeholder engagement, and ethics committees are part of this governance system. And a governance system could do all the following things. It could outline responsibilities of various partners, establish measures of accountability, monitoring, and monitor and audit the registries. And finally, some people have suggested, finally compliance, and some people have suggested that governance committees should be established to oversee policy development and use. Given my background, I cannot finish my talk without making a reference to the important role of research ethics committees, at the same time recognizing that ethics committees have limitations and do not often have the capacities to review and provide oversight to all the data-related issues, given the ever-increasing complexities in how data is stored, encrypted, shared, retrieved, etc. At a minimum, they should have capacities to ask the right questions and refer relevant issues to the data governance committees or structures. Importantly, they should be open and flexible and aware of the current research architecture, and be willing to understand and implement consent models that respond to the needs of researchers and further the public health mandate of research. Thank you so much. I think I will stop here, and if there are questions, happy to answer them.
Thank you very much, Abba, for a tour of the ethical issues related to data sharing. So moving swiftly on, the next speaker is Dr. John Amoasi. Dr. Amoasi lectures at the Global Health Department, School of Public Health, Kwame Nkrumah University of Science and Technology, Kumasi, Ghana. He's Executive Director of the African Research Network for Neglected Tropical Diseases. He is the group leader of the Global Health and Infectious Diseases Research Group at the Kumasi Center for Collaborative Research in Tropical Medicine and the Bernard Knox Institute for Tropical Medicine in Germany. So without further ado, I shall hand over the floor to John. John, please.
No, thank you very much for that, Fake. Appreciate it. I'm conscious of time, so I'll try and go through pretty fast. But I'm going to give you an overview of a sort of practical application of coming together to collect the same kind of data and then explore approaches towards sharing it within this pandemic that we are living for the COVID-19. So ALERT is the African Coalition for Epidemic Research, Response and Training. I'm sure many of you have seen the slide several times before, but the beauty of this is that it involves partners in all parts of sub-Saharan Africa, East, West, and Central, and actually we are interconnected with others in the South and in the North as well, and collaborators, colleagues in Europe. This is just these are just some of the partners who are part of ALERT. Why clinical characterization is so important. We are looking at this because once we're able to interconnect data that is being collected from different places, we believe that we're able to have comparable results, and that we can have much larger data sets, which can then provide information which is much more impactful in informing decision-making regarding treatment options, regarding various control measures that we may want to put in place to address the problem. And so we're looking at collecting clinical data essentially from across the continent on COVID-19. I'll proceed and just explain to you a bit more about this clinical characterization protocol, which Alert has been running. So there was an existing protocol for this, and Alert took this and customized it to suit unique or peculiar situations in Africa. And we're using this protocol across several African countries, which I'll explain in a bit. So we modified this, and what is good about this is we've made these tools freely available on the Alert website and also on the TGHN website for partners who would be willing to also engage within Africa in looking at the clinical characterization of COVID-19 to be able to join in. The interesting thing about this also is one would think that, okay, we know enough about COVID already, but you would realize that as this pandemic travels, the clinical presentation seems to evolve and seems to evolve along with the variants that emerge from time to time, which is why it is so critical that while we have come a long way in our clinical understanding of COVID, that we also continue to collect this kind of data. So here, what we're doing is we're collecting both socio-demographic as well as basic clinical data, signs and symptoms, but also going further to be able to collect biological samples and information from those samples that will come via blood tests, urine tests, stool tests, and so on. Now, the great thing about this setup is that we are flexible, which allows different sites, different countries to collect different levels of information, right from just the basic information from the patient through to signs and symptoms, and then also to the information from the labs that are conducted. And the good thing is that we're able to nest within this framework studies that would like to look at co-infections, the clinical outcomes of use of steroids and other medications, as well as even long COVID, which we're looking at layering on top. Now, the more interesting part relevant to this would be the setup, which is the way in which the data is collected, either on paper and later entered or directly onto an eCRF. This is uploaded onto a REDCap server, and I'll come to what I mean by the REDCap server in terms of whether it's central or decentralized. The research team naturally has access to this information, and then the stakeholders within the country, be it the ministries of health, other stakeholders who may need to have access to it, also are allowed to have the data that they need. So currently, with the Alert clinical characterization protocol, in Senegal, we have over 1,400 records, in Cameroon, 409, in Ghana, over 3,000, in Uganda, 387, looking at starting data collection in Kenya and in Guinea, and as well as in the DRC, starting in September. Now, it's important to realize that within these numbers that you see here, there are different levels. For example, in Cameroon, which has 409 records, these are much more detailed than, say, in Ghana. So in Cameroon, they're collecting serial samples and following up the patients over a period of time, whereas in Ghana, for example, it is your basic data, clinical data collected from the patients over the course of their stay in a health facility. So you realize that with this different levels of data collection, there comes the issue of how we would go about harmonizing and ultimately sharing this data. These are some of the challenges that we've had to face in coming together to collect clinical characterization data. Within these challenges, or some of these challenges have come as a result of us wanting to move pretty fast to allow countries or sites to collect the information that they would like to collect. Normally with these kinds of studies, we'd like to have everything nicely harmonized, agree on making sure everybody's doing the exact thing before we start. But in a pandemic situation, you obviously have to allow for speed and for flexibility. What this means is that you trade off some elements that make data sharing easier for this flexibility, which allows people to do what they want. And only later do you come back and see how best you can glue together the pieces of the puzzle and even get around the knotty ideas of the knotty issues of data sharing. And this is why I say flexibility is the key. So in ALERT, these are three options that we have presented to all participants in this clinical characterization protocol. I'll not read through each of them because of time, but I'd just like to mention that you have an option of having a fully centralized data management system where the REDCap is set up for you, you're given access, and your data goes into a central repository. The necessary passwords and protections are set up so that only those who you want to access your data can have it. On the other hand, you may want to build your own database, but benefit from a central hosting option, and we make this also available. And the third option is where you want to build your own and manage your own independently. What this means is we will support in providing you with the XML files and any other relevant information which you can take and build and host. But the challenge really is making sure that there is harmonization across all the sites depending on what they are doing. And this is what we're currently grappling with, making sure that we can map the variables across all the sites that started off with their own XML files and CRFs, albeit harmonized at a certain much higher level, but now we need to look at it at a more granular level to ensure that we can actually do a meta-analysis and come up with something that will be a reflection of what is happening across the consortium. But when it comes to the issue of data sharing, what is really the biggest challenge, and I think Abba, you touched on this in your presentation, is the opportunity to make the most of the data. And this varies significantly across, even within our sites of membership in Africa, and then also between Africa and Europe, and then in North America. So the real capacity building, which would allow for truly equitable data sharing, would be being able to support with the skills in being able to make the most of the data. I'm happy to say that our central data management is actually with our colleagues in the MRC, in the Gambia, in West Africa, and also at the level of Ghana, being able to provide support to members who wish to actually build electronic dashboards, which allow the real-time display, graphical display of summary data from the CCP, which can then be made available to stakeholders and authorities in country to see real-time and then apply this to control and treatment decisions. So I'd like to stop here and just say thank you to all the partners across the various countries that are participating in CCP and ALERT, and to our funders, ADCTP, the European Union, and welcome. Thank you.
Thank you very much, John. So apologies, we are running over time a little bit, just bear with us. We have one more talk. This talk is done by both Dr. Yo Yehudi and Jeremy Gillen. So Yo is the open source technology lead in the Wellcome Trust Data for Science and Health team with a background in research software engineering. She's also a researcher at University of Manchester, researching responses to COVID-19 sharing barriers. Dr. Jeremy Gillen is a senior advisor at the Canadian Institute for Health Research Senior Science Policy Branch, where he's the lead on open science policy development. He's also the chair of the Gdpr Data Sharing Working Group. Yo and Jeremy will be speaking to the funders' perspective. I believe Yo is starting, so please go ahead.
Thank you very much for that beautiful introduction. So today I'm just going to talk a little bit about some of the things that we've been doing as funders hands-on to address some of the issues that have been highlighted, especially around things like fair data, for example. So quickly, I'm going to talk a little bit about specifics around what Wellcome does and how we collaborate with others, and then Jeremy will talk a bit more generally about funders. So one thing that I think we've made really clear in the last few presentations is how important it is to make sure that data is shared effectively. So one of the things that Welcome does is that we actually ask people to deposit data in 2 different places, just to really maximize the option of people being able to get to the viral genomic sequence data in question. And we also prefer that people, grantees, avoid embargoes on COVID-19 data where possible, although there are scenarios where you can have up to 3 months of embargo if needed. So I also wanted to highlight that it's also really important to help make sure that people have the tools and the understanding that they need around data sharing. So one thing that we do as part of the COVID Therapeutics Accelerator is that when grantees actually are awarded their money, they're also offered in-depth guidance so that they can manage the outputs. So that makes sure that actually people know the effective and really good ways to share data so that other people can reuse them in the future. And finally, I just really quickly wanted to highlight a couple of the platforms. So if you look for IDO, that's the Infectious Disease Data Observatory, that is actually on the list of platforms that was linked to earlier. That both IDO and Vivli are grantees through the COVID Therapeutics Accelerator I mentioned earlier. And they are actually working to make sure that private data is available faster so that it is easy for people to actually reuse this data and trying to make it more fair as well, whilst also increasing the credit that data contributors get by coordinating with ORCID, for example, so that you can have the data deposits on your ORCID ID. And with that, I will hand over to Jeremy.
Okay, thanks, Yo. So as Yo mentioned, I'll give a somewhat higher level view of funders' policies, but through the lens of policies of the Canadian Institutes of Health Research. So as I'm sure many on this webinar are aware, in recent years, there have been various policies, frameworks, and agreements related to the promotion and support of data sharing. These have been at the international, national, and regional levels. So I've just included here some examples that Canada is involved with. So for example, the OECD recommendation on access to research data from public funding, the Government of Canada is an adherent to that. The Declaration on Research Assessment, which of course isn't specifically focused on research data sharing, but does speak to the importance of research data in assessment. And insofar as it does that, I interpret it as promoting research data sharing. CIHR signed DORA in 2019. The Government of Canada Roadmap for Open Science supports and promotes research data sharing. And lastly, I've included 2 examples here of funder policies in Canada that the CIHR is a member of. So the Tri-Agency Statement of Principles on Digital Data Management and the Tri-Agency Research Data Management Policy. Though it's important to note that those policies don't require data sharing, although they encourage it. Now, whereas many of those policies and statements that I mentioned on the previous slide are really aspirational in nature, you know, by signing on to them, you know, signatories are expressing their commitment to data sharing or to develop data sharing policies. As I mentioned, the 2 policies that I mentioned from Canada, the tri-agency statements, they don't require data sharing, but they encourage it. But you know, from a funder's point of view, one thing that's been very significant in the context of the COVID-19 pandemic is that you've seen these statements arise that are much more pointed and explicit in their call for sharing COVID-19 relevant data. So for example, we have the joint statement on sharing research data and findings relevant to the COVID-19 outbreak. This is led by the Wellcome Trust. And it's building on the statement on data sharing in public health emergencies, which was launched in 2016. Currently, there are 160 signatories to this joint statement, and those are various organizations that have signed on, not all funders, of course, but including publishers, institutions, and so on. Another key document is the National Science and Technology Advisors call for open access to COVID-19 publications. I included here because as part of their statement, they also specify that the underlying data supporting research conclusions in publications should also be made available. And so this is a call from the National Science Technology Advisors from 15 countries and the European Commission. And so these high-level policy statements have had a real impact in the funding environment, at least for the example of a CIHR, it's had a real impact on our policy requirements. So, for example, most of our COVID funding opportunities include this condition that data produced as a result of COVID-19 funding must be shared in line with the joint statement on sharing research data findings relevant to the COVID-19 outbreak. We also reference the National Science and Technology Advisors statement as some of our conditions, namely to make papers open access immediately. And I should note that you know, this statement is really noteworthy, the joint statement, because although CIHR has required data access and data sharing for specific funding opportunities, and at times has required sharing of certain types of data, this is the first instance where we've had such a broad requirement for data sharing as part of our funding opportunities. And I suspect that it's a similar case for many funders around the globe. So as a result of this unprecedented push to share data, there are a number of questions that funders are asking themselves, or at least in Canada, we're asking ourselves. So for example, with respect to researcher practices, have researchers complied with the data sharing requirements? Where are researchers sharing their data? Are the data fair? And then there's, you know, questions related to platforms and registries. So for example, this push for data sharing, how has it affected the landscape of data platforms and registries? How has that landscape developed during COVID-19? It also raises questions about interoperability, access, and governance generally related to these registries. And so, you know, the platform that Lauren and her team have developed the resource, the review of platforms and registries, I regard as a key tool to inform answers to these and other questions. And that's one reason why I'm so excited about the work they've done. And that's it. Thank you.
Thank you very much, Yo and Jeremy, for that very interesting talk from a funder's perspective. So we've come to the Q&A session. Apologies, we're running a bit late, but the panelists have agreed to stay for another few minutes to answer some questions. So let's get right into it. What would you like to do? Do any of the panelists want to answer a question from the chat? If so, shout, please.
Yeah, I think I could.
Okay, go ahead. Yeah,
no, thanks, Vic. I just see a question from Toby asking if we had any pushback from researchers who didn't want to share data from their patients because they wanted to publish. You know, this is something that we really struggle with all the time. And as you know, in a pandemic, there's evolving knowledge and information. And yeah, we have had, you know, tough discussions on this. And so what we agreed to do is, yes, we will share our data, but the analysis will be conducted in such a way that it doesn't take away from, you know, country-specific nuances or things that will be of very specific interest to countries. So what that means is we have to agree to some level of dilution of what will be presented at the, you know, macro level or the metadata, so that when a country-specific publication is put out there, it doesn't look like it's old information. I mean, these things are things we need to deal with and agree with, and the earlier they are discussed, the better. So yes, we have had these kind of tough discussions, and this is what we've agreed to do. There's also the argument of who publishes first. Do you do the consortium publication before you do the country-specific ones? And I think there just has to be agreement on timelines and a decision that if by so and so time your country specific one has not come out, then we agree that we'll do the consortium level one, and this is what we'll put in there to allow you to have the chance to also put your country specific thing out there, which doesn't take any, has nothing taken away from it by the larger publication.
Hi, so yes, I wanted to respond to the second question by Toby and also partly to Nita. And this is about how best to ensure that structures are in place to gather data from infected persons in the community, etc., in the early phases of a future outbreak. And I think part of the answer would be to have prior to, so in general, during peacetime, to be having an extensive stakeholder engagement and extensive public engagement to talk about the benefits of data sharing and how that can be useful. The second thing is to be engendering trust in the communities that you will hopefully or potentially be working with by showing that what the work that you do comes back to them. So there's a lot of prior work that needs to be done. And in addition, of course, you need to have policies, right policies in place. The government should be responsive to what the work that you're doing. And I'm sure John and others will be contributing much more to this. But also responding to Nita about fair principles to protocols and part of ethics board reviews. I think that's partly true, but a lot of the fair principles are technical issues. And I doubt that a lot of ethics committees will have enough capacities to review this. So perhaps data access or data review committees should also be established where you're planning to do these works. And ethics boards should be aware of such things and be willing to transfer or, to say, okay, these are our responsibilities, but the further responsibilities are not with us, but with others. I think that's all I want to say for the time being. Thank you.
Thank you, Abba. Susana has a comment.
Yeah, just to pick up on that, I would like to add a small addition while agreeing to everything said, that I think it would be very helpful to pre-structure different data management plans that might apply in such cases, because in the course of COVID-19, we have been confronted with so many data protection issues that could be previously clarified and which relate certainly to new laws. I mean, if a law is only 5-6 years, it still counts as new, and that there is no real experience in applying it, but also more general issues around, fair also as legal principle, ethics and the law, the roles of research committees and whether they should be involved into the data protection assessment. That has been said in the ethics talk very rightly, and all those issues, and there is no work done on that, and every time an emergency situation comes, then we would be standing there without having the knowledge how to go about this. And I think really that many questions can be approached in a standardized manner. Maybe, of course, according to the respective situation, you will need adaptations, but to sort out how is at all data management possible in such cases would be really, really helpful, I think.
All right, thank you very much. So we have a few minutes left. I would like to direct some questions to the panelists who have not spoken yet in the Q&A. Maybe the first one is to Lauren. Lauren, how can we use the platforms and registries? What are some actionable items that you want the attendees to take away?
Yeah, so one of the things that we hope is that the resource will generate more research. So as Susana was saying, we could really dig deeper to think about how have regulations or laws like Gdpr led to this siloing of data types. So how has that kind of driven the separation of clinical data from OMICs data, from imaging data, and I think people can use the resource to then pursue that research, which hopefully could lead to some policy change and better preparation for the next pandemic or the next wave of COVID. And also, I think the interoperability of governance and legal frameworks is something that's key. And I've heard from a number of platforms and registries that they need more information on what good governance looks like and what benefit sharing and community engagement when done effectively look like. And so I think that that is a conversation that hopefully we can have with these different data sharing resources to then come up with a community-driven way forward in terms of governance, benefit sharing, and so forth.
Thank you. And Rob, do you have anything to add? So Rob is representing the TDR here.
Well, no, thanks. I think it's been a good panel, and we've covered many of the topics. I think our desire in sort of supporting this work and other work around data sharing is really to try to push forward solutions to the numerous challenges that we've heard raised. And I think we are slowly getting there. I think the work that Lauren's done has shown us that we don't have any shortage of sharing initiatives. What we now need to do is to maximize the utility of those, and we've heard the different ways that we can do that. And I think particularly around greater interoperability of the data itself, and also, as we've heard, I think interoperability of the governance processes, probably the two that stand out for me.
Thank you. Thank you. We haven't heard from Yo and Jeremy. Any last words? And Susana, but you've answered many online. But if you'd like to add some more, please jump in.
I'll just throw one real quick comment in, which is we've talked a lot about the data that's available and what challenges there are. But when we do reuse data, try to cite that data source so that people are happy to share, they get the credit that they need.
Cool. Good advice. Jeremy, anything to add?
No, I think just to echo what Rob said and the usefulness of the resource that Lauren and her team have developed. I mean, as I mentioned in my talk, but just I'll elaborate on it a little bit. I mean, funders have a fundamental interest in understanding, you know, the environment that they've helped develop with respect to research data sharing, not only to improve, you know, the practice within this pandemic, but also to you know, develop the conditions to facilitate, you know, research data sharing in the context of the next public health emergency, but also I think, you know, research data sharing generally. So on that note, I just wanted to say again, the importance that I think this work that Lauren and her team are doing and how excited I am about it.
Thank you. I think you have the last word, Susana.
Well, I will just emphasize the question that one of the attendees put, which is it's not just about data set, it's about the code, the model, the software, anything that really enabled the reproducibility and the use of the data. It is as important. And so, and like I put in the link in for sharing, we also have this type of registry. So it's important to make sure that the policy direct also the user to make sure that these other digital objects are also preserved and available to reuse the data at the same time. Thank you.
Well, thank you, Susana. So that leaves me to thank you all again, the attendees and panelists and TDR, COVID Coalition, as well as DGHN. All right, thank you very much and see you again next time.